name is Sam, and I'll be your student nurse today. Can I please get your name and date of birth?
Abraham Lincoln, February 12th, 1809.
Okay, I'm just going to take a look at your wristband. Okay, Mr. Lincoln, so today we are, I have an order for you for a catheter for urinary retention, okay?
Okay.
Have you ever had a catheter before?
I have not.
No, okay. Do you have any questions?
No, I don't.
Okay, we'll start the procedure by doing some pericare, okay?
Okay.
I'm going to lift up your bed first, and then do you have any allergies?
No, I do not.
Okay. Okay. I'm going to put this side rail down, and I'll be right here the whole time. And then I'm going to start by putting gloves on. Okay, and then I'm going to start by removing your linens, okay?
Okay.
And I'm going to make sure that they go all the way down to the foot of the bed for the procedure. Just so they don't get soiled. And then I'm just going to remove your gown, move it up, and then expose you, okay?
Okay.
And then before we start, I'm just going to adjust your legs. So I'm going to start by putting a towel or pad down so that I don't get the rest of your linen soiled. And then I'm going to start by using a soapy washcloth and then clean off by starting at the head of the penis and then going down the shaft. And then going down the sides. Okay, and then I would dispose of this in a soiled linen bag, and then I would get a new washcloth that has just water on it and do the same thing. Start at the head of the penis. And then down the shaft again. Just to make sure that there's no soap residue left on the patient, and then down the sides. Okay, and then I would remove these linens and put them in a soiled linens bag. Okay, so now I'm going to remove my gloves and perform hand hygiene. Okay. And then I'm going to start by putting down a trash bag, the end of the bed. Now I'm going to get my supplies ready. But before I do that, I'm going to get my tape ready. Okay, now I'm going to start. Making sure I'm keeping that 1-inch border. Okay, and then I'm going to take the end of my drape, making sure that I'm keeping sterility, making sure I'm keeping that 1-inch border, and then I'm just going to gently lay it down, and then when I put my sterile gloves on, I'll adjust it. So now I'm going to put on my sterile gloves. making sure I'm maintaining sterility. And then next what I'm going to do is, now that my hands are sterile, I'm going to adjust my supplies on the sterile field. And then just making sure my catheter is ready. I'm going to open up my lubricant and then place the end of my catheter in the lubricant, making sure that it is ready for me to use. Okay, and then what I'm going to do is I'm going to take my 10 cc syringe and put it in the lock so that I'm ready to use it when I'm ready, and then open up some swab sticks to clean the area before inserting the catheter. So now that I have my supplies ready, I'm going to adjust the sterile field, making sure that it's enough for me to put my supplies on my sterile field. So making sure that I have it the way that I want it, placing my supplies down carefully on the sterile field. So now that I'm ready to start the procedure, I'm going to use this as my dirty hand and pull back the penis and use my swab sticks to sterilize. And then I'm going to start at the urethra and circle my way down the penis. Okay, and then I would throw that in the trash. And then I'm going to do this 2 more times. Okay. One last time. Okay, throw it in the trash and then dispose of my trash. So now I'm ready to insert my catheter. So what I'm going to have you do is you're going to inhale and then exhale, and then when you exhale, I'm going to insert the catheter, okay?
Okay.
I'm going to take my catheter out of the lubricant, and then whenever you're ready. Inserting the catheter until I see a flash of urine. Okay, see a flash of urine. So then I'm going to keep going another 1 to 2 inches. Making sure that I don't break sterility. Okay, so now what I'm going to do is carefully exchange. I'm going to grab the tip of this part of the catheter with my sterile hand. I'm going to inflate the balloon. Okay, and then I'm going to use my non-sterile hand to take this off, and then I would dispose of this in the trash can or in the biohazard bag. And now what I'm going to do is I'm going to pull for resistance. And then resistance is felt, so now I know that the catheter is in the bladder. So now I'm going to take out my catheter, dispose of this. I know that sterility is over, so I can make sure. I'm going to place the bag here, and then I'm going to dispose of my pad, and then what I'm going to do is I'm going to just adjust your leg, okay? And then I'm going to place the catheter on the outer portion of the thigh and tape it to secure it. And then I'm going to dispose of all of my supplies. And then what I'm going to do is I'm going to make sure that the catheter bag is unkinked and put it on a non-movable part of the bed. Again, making sure that it is unkinked. Okay, so now I'm going to remove my sterile gloves and perform hand hygiene. And then I'm just gonna help my patient get into a comfortable position in bed. Okay. How do you feel, Mr. Lincoln?
Pretty good.
Okay, that's good. Any pain at all?
No, not right now.
Okay. Okay, and then your call light is right next to you. I'm gonna put your side rail back up. So if you need anything, please let me know, okay?
Okay.
And then I would lower the bed and then perform hand hygiene again. Hi, my name is Sam and I'll be your student nurse today. Can I please have your name and date of birth?
Abraham Lincoln, February 12th, 1809.
Okay. I'm just going to check your wristband. Okay, Mr. Lincoln, do you have any allergies?
No, I do not.
Okay, so today we have an order to remove your catheter, okay?
Okay.
Do you have any questions at all?
No, not at the moment.
Okay. So I would lift up the bed and then prepare by putting on my gloves. Okay. So I'm gonna move down your linens. Is that okay?
Yeah, that's fine.
Okay. Put all the way down so that we have enough room for the procedure. And then I'm gonna expose you by moving your gown up. Okay. I don't see any complications. I see that your catheter bag is empty. Did someone come back in here and empty it before?
Yeah, they were just in here.
Okay, good. I don't see any urine left in the bag. So now what I'm gonna do is I'm gonna put down a towel or bed pad. And then I'm just gonna adjust your legs, okay?
Okay.
So that way I can slide this towel down. Okay. All right, so now what I'm gonna do is I'm going to take my 10 cc syringe, and I saw in the order that there were 10 cc's inserted into the balloon. So I'm just gonna make sure that all 10 cc's come back out. I'm gonna start by deflating the balloon. Okay, and then I would dispose of this in the biohazard bag, which I have. And now what I'm gonna do is I'm gonna have you inhale and then exhale, and then when you exhale, I'm gonna pull the catheter out, okay?
Okay.
Okay, pulled it out in one smooth motion, and now I'm going to untape the catheter from the upper thigh, and then gather the catheter, and then I would dispose of this in a biohazard bag. Okay, and then what I'm going to do is I'm just going to get a washcloth that has soap on it, and then I would just clean make sure that there's no residue, also monitoring for any redness or any lesions. And then I would dispose of this in a soiled linen bag and then get a new washcloth that has water on it, and then also clean the penis very lightly because I know that it is sensitive. Okay, and then I would also dispose of my supplies in a soiled linen bag or the biohazard bag. Okay, and then I'm just going to help adjust my patient in a comfortable position. Okay, Mr. Lincoln, are you experiencing any pain?
No, not at the moment.
Okay, so just a little education to give you, since we did just remove your catheter. I would definitely drink lots of fluids. Please let me know when you go to the restroom. When you first go to the restroom, you might experience some burning pain sensation. That is normal. But please let me know when you do go to the restroom, okay? And let me know if you have any difficulties going to the bathroom.
Okay.
I'm gonna start by putting the bed down. Okay, I'm gonna remove my gloves. Do hand hygiene. Okay. Well, you have your call light, Mr. Lincoln, and you let me know if you need anything, okay?
Okay, I will.
Making sure that the bed is locked, and it is. Putting down my bedside table, and then I'll dispose of my trash.